So first of all, we just both wanted to, well, I'm Charlie Blaich,
Kathy Wise.
in case you don't know. Thanks so much for being here. Actually, it's really wonderful to see many of our good friends that we've worked with for many years, people we know, and to geek out a little bit about assessment for a day or so, and think about what's coming next. And it actually comes at a good time for us because we've been doing this for about 11 or 12 years now, not 35, but long enough that we were constantly thinking about how do we revise things, how do we get more effective at our work. So this is a good moment for us, at least to think about this. So thank you for being here. Okay, the title. Walking the assessment beat in the mean streets of higher. So we will explain this. This actually is meant to point to a limitation, actually, of our remarks a little bit, because we're not operating from the 60,000-foot level, and we'll talk about that in a second. So. Okay. And what we'll do here briefly is just we're going to give a little background on the Center of Inquiry. And then, again, looking back in the last 10 or 12 years of our work, we're going to talk about things that we've seen getting better, from our perspective at least. We're going to talk just briefly about what we call obstacles, things that we still think get in the way of the work a little bit. And then we're going to have what we are starting to see as the challenge, or one of the biggest challenges going forward, that we're grappling with based on our work with the college and universities and the folks there that we do work with. So.
Okay. So we know a lot of people in this room, and we know some of you very well. But for the folks we don't know as well, we just wanted to give you a little background on the work we do at the center, because I think it's pretty unique. I think we're blessed to have a really different opportunity in higher education, and our work has evolved over time. In fact, so my family still doesn't really know what I do when I try to explain it to them, but I'll try it again here. So our mission at the center is to strengthen liberal arts education for all students. That's all students regardless of their background, the type of school they go to. And when we talk about liberal arts education, the other important piece to note is that we take a very broad view of liberal arts education. So we see it as an education of the head and heart that contributes to the broad qualities that you see in pretty much any college or university mission statement here in the United States. So that means that we work with all different kinds of schools, from private liberal arts colleges, state universities, regional institutions, community colleges, and that's a great part of our work. And what do? We work with folks on the ground, with faculty, staff, students, administrators, to help them uncover, understand, make use of, and use evidence to improve student learning. But what does that really mean? Because that's, the huge statement. What does that really mean? How do we work? Well, we now have three parts. This is our new logo, by the way, new branding. It's fabulous. We did not design this. We designed all the previous logos. This was developed by professionals.
We actually have one with Unikitty, if you know who that is. That's not good, okay.
So, first part of our work, newly branded as Atlas, Academic Teaching and Learning Assessment Support, but that's just a fancy name for the work that we have been doing for many years with institutions. So an institution will call us up and say they'd like us to come and talk to their faculty about assessment, run a workshop, meet with departments, help with an upcoming accreditation visit, help them think about faculty development, revising general education, work on program reviews, grant reviews, do focus groups with students and faculty. Those are all the sorts of things that we do in this arm of our work. Second arm, Teagle Assessment Scholar Program. So we have a group of around 60 or so assessment leaders, institutional change agents. Several of them are here in this room: Michael, Jillian, Dosha, Cindy. I'm probably, have I forgotten anyone? If I have, I apologize. Catherine, sorry, Catherine. I'm like, I knew I was going to do that when I started. So these folks, they occupy various positions in their organization, but the key thing that brings them all together is an intense desire to improve student learning, to use evidence to do that. And so we try to support these folks. We offer workshops, create a community of practice where they can come together with like-minded individuals. We also learn from them, and they're part of sort of a virtuous cycle in assessment where they volunteer to help us in our work with institutions, which is a great thing. We think giving back to the higher education community is a key part of our work. And then the last part, Higher Education Data Sharing Consortium. We have acronyms, of course, because it's higher education. You've got to have lots of acronyms. This is a consortium of around 140 institutions that openly share data of all kinds to help support their missions.
Not yet.
No, not yet.
So I think one of the things about our work has been that when I was a faculty member at Wabash, I was just thinking about this in terms of all the sort of history that you described. I taught my first university course in 1981. And I taught at one institution, got tenure there, moved to another institution, and I actually never heard about assessment until about 2000, I would say. It wasn't on my radar. In fact, that's what came on my radar when we got the grant doing this. But I think we've always had the position we got, because of the Lilly Endowment, Wabash got a lot of money to start a center of inquiry. We never thought of ourselves as I was never thinking, I'm a policy guy, I can do policy. There's also some good policy folks out there. And I just remember early on hearing this idea that policy people were thinking about levers that they could move to change things. I kept thinking, there's someone at the tip of that lever, right? And that's where we're going to work. That's where we can make a difference. That's what we've always done. So, the assessment mean street. So what's this supposed to represent?
And who is that poor person?
Yeah, exactly. That's a fact we were saying. Yes, the assessment. No. And that's not actually us, although the woman has a gun. You should notice that.
But I've gotten taller in that picture,
exactly.
too, so I kind of like that.
So I think what we meant to say is that we do really work closely on the ground. We work with a lot of institutions to this day that are starting grants or programs, trying to initiate assessment efforts, trying to revise ones that haven't worked, do that kind of work. So we get to see a very granular picture of things. We get to see things that are working and not working. And we think about every institution. I was talking to Marianne last night, have folks who are doing some incredible things, some that are real obstacles, cave dwellers committed against virtually everything people. And so in a sense, we don't actually have a good overall picture of things. Our work really, we tend to, I have a friend who works in the Crawfordsville Police Department I talk with often, and I'd say, how are things going and stuff like that. And he'll say to me, I can tell you about stuff, we can talk about it, but I never actually get a really good picture of how things are going because I'm only called into places that are hurting a little bit or trying to start things. I see some good things, but I have a kind of sort of skewed view because I'm working with things that are not always going well. And I would say that that's not going well, but people are struggling to start things. We spend a lot of our time there. So these remarks are coming from that perspective on things.
So we've been doing this for a little while now. Center started in 2002, the Wabash study, the pilot started in 2005, so amazingly it's been a little while, and in that time we've seen a lot of things change and a lot of things improve. So we wanted to talk about 3 of the changes that we've seen. Grudging acceptance, not outright hostility towards assessment, better use of student work, and framing assessment as inquiry. So when we first started, we asked folks, what do you think about assessment? Typical responses would look something like this. With the, you're infringing on my rights as a faculty member, violating academic freedom. I think my favorite was a gentleman who said, faculty need to rise up, take to the streets, and protest this. I don't know why I pictured pitchforks when he said that. But this was sort of what we heard. And while we still hear some of those things, they've definitely decreased. And now, if you ask, what do you think of assessment? I'd say responses are more like this.
You want me to go next? If that joke landed like that, I'm going to go, okay. Yeah, so it's sort of like, there's what oh, that was bad.
And that was it.
Yeah, there we go, okay. Yeah, so I would say what's really interesting is when we first started, we would go to places, we actually had to adopt this mantra of never use the A word or never use A-related words, right? So you wouldn't say student learning outcomes or assessment or things like that, closing the loop. You would talk about inquiry and things like that. And it's really interesting in the last couple of years, I'd say, as we've gone to schools and gone to workshops, more and more, we still, sort of that's an ingrained habit, and more we'll see people are starting to talk about assessment. Oh yeah, well, our student learning outcomes are this and that. It just feels like the temperature on that, on actually A, talking about assessment, and B, the sort of, we can't even use the way, some of the jargon and lingo from assessment is really going down, and there are more people who are just, they're going to do it. Okay, they're going to do it. But I would say it's still, for the most folks we work with, is still driven by accreditation, professional and regional accreditation. And I think we'll come back to this later, and the perceived demands of accreditation, okay? I think there's a really interesting disparity. I think what I'll say is that when I first started working with Nessie did the DEEP project, I remember hearing this old saw that there was the curriculum as the faculty understood it, the curriculum as students understood it, and the curriculum as it exists in the academic bulletin. And I think there's accreditation as people in the accreditation organizations see it, there's accreditation as administrators see it, and there's accreditation as any faculty understand it. And they have different, they're overlapping but very different in some cases.
So another thing we've seen is a much different, better use of student work. So when we started working on assessment, a lot of institutions we went to were looking for a test developed by somebody else that would help them measure all of their outcomes and give them a number that they could put in a report and satisfy the accreditors, their deans, et cetera. And there were problems with that, of course. One, people said, well, how can we possibly find a test that will help us measure these broad, ambitious outcomes we have for our students? And then the other problem was when you got data back from a lot of those tests, people said, but what does this number, this score mean? And it just didn't feel connected to the work that faculty and staff were doing with their students. So now when we go places, we hear people talk about using student work of all different kinds. Papers, performances, presentations, journals, reflections, talking about using rubrics to evaluate that work, and that's great because that really connects to the work that people are doing with their students so they see how that fits with their goals and objectives, and it's much more authentic.
Yeah, I think when we would talk with institutions, even with assessment committee, sometimes we go and we do consultations on how do you structure assessment committees, and like our advice is that the closer the more you can make it so people leave a meeting saying, hey, I could try this in my classroom, the closer you're getting to get some stiction with assessment. And I think that's, in a broader way, I would say, I think that when we see efforts that really start to take off and germinate and start growing, they're all somehow revolving around inquiry, that the faculty and staff are included in a lot of this, certainly. Is the assessment work actually some process of thinking hard, gathering some information about making sense of what students are doing that I can then use in my programs or classrooms and so on. And there's lots of different ways in, but it's framed at inquiry it works, and it can be scholarship of teaching and learning, it could be DQP, and when you're really thinking about your degree qualifications, what you want, anything gets that piece as opposed to we're doing something because someone's asking you to do it from the outside, gets traction. And to this day, I think, and again, I know there's lots of national movements here, but we visit institutions, we'll talk about what assessment should be as part of your conversations that you're having with colleagues about what's working, what's not working, so that you can. We still have people come after we talk about it and say, thank you so much. That really helps me think about this in a different way.
So, well, we've seen lots of changes and improvements. I have to say there are still many obstacles, some of which have been there from the beginning, some of which have changed over time, or new obstacles as assessment has grown and changed. So 3 of the things that we wanted to talk a little bit about. We do it because we have to, it's still an add-on and time. So this is where we go a little dark. We started with the positive, now we go a little dark. So, perfect. So, thought experiment here, hypothetical situation. If accreditors no longer required assessment activities, and if all of the grant money for assessment, course redesign, faculty development, et cetera, dried up, how much assessment work do you think would actually happen? That's actually, I was almost none, but you know, that's me going dark again. So, and I think this is because for a lot of folks, they still see assessment as an externally mandated thing they have to do, whether it's for the accreditors or their administrators, the department chair, someone else is asking them to do it. We don't meet a lot of people who see assessment, learning improvement as a part of their professional identity, responsibility. So it's not something people tend to do with joy and happiness. They do it to get the assessment monkey off their back so they can go back and do the real work or what they think their real work is. And unfortunately, I think that because of that, because people they think they're doing it for someone else, and they have all these misconceptions about what these other groups and people want, which are often not good, they wind up doing assessment in these time-intensive, not helpful ways that reconfirm all of their bad ideas about it and just basically turn assessment into the nightmare they always thought it was.
Yeah, I mean, how many places we worked with who have their conversations about general education came down to 35 outcomes that are distributed over 650 courses in a school of 3,000 students.
Yes.
And they're a cycle of going to do 7 or 8 a year and chug. Yeah, it's just.
Yeah. Or when we'll talk to a department, and we ask them about assessment, and they say, well, there's this matrix or this report or something, and you know, they just, there's not a lot of happiness in what they talk about. And then we say, well, okay, tell us about a change you've made in your department or something you've done. And they'll get much more animated. They'll talk about things that they've changed, why they changed it, how they looked at student work. And then you say, well, did that go in your assessment report? No.
Yeah.
Why would it go there? Yeah. It's not connected.
Yeah.
So.
Yeah. There was no number attached to it. Okay. And I think the other thing for us, still, this is my notion of an icon of an add-on, right? A wrench with a flashlight on it. And I think in a lot of places it's still not part of the institution in a deep way. It's still added on. So for a lot of faculty and staff we work with, no one said, why don't you cut this part of your work out so you can spend a lot of time doing this intensive work on assessment. It's added onto it. It's often not incorporated into it. Maybe it's part of service at some places, but it's certainly not part of people's scholarship at a lot of places. It still seems like institutionally there are committees grafted on. A lot of places we work with the list, it's an add-on. And I guess the analogy I would make is that at the various institutions I worked at before I started doing this work, we had these mandatory committees on campus. We had the Health and Safety Committee where we would do our how we dispose of nuclear waste reports, which are federally mandated. We had other health and safety. And some of these reports, and what I will say is that people on the committee, we'd get together, we'd do some really hard work on this stuff to make sure it was right, and do it. And then, as soon as it was over, we put it down and moved on to something else, right? It was work we need to get done. We wanted to be compliant with the standards. It was funded at a minimally compliant level. But I never went back to my office thinking, okay, I'm teaching a class animal behavior and I'm thinking about nuclear disposal, waste disposal. It's not integrated into my work. And I think, at least for a lot of places we work with, when they're starting, this still feels like this add-on piece. Okay. So this gets us to the challenge we've been thinking about, just reflecting on some work recently. So this is the classic project management triangle, right? This is the idea that when you have a big project, you've got 3 dimensions you can work on. These are 3 dimensions that pull against each other a little bit, right? You can worry about how much it costs, right? You can try and do it inexpensively. You can worry about how good the project will be, right? And you can worry about how fast you're going to do the project, the speed and the pace. And the idea is these are great things, but they do pull against each other, so you always have to sort of agree to pick 2. Right? You can't do it cheap, good, and fast. It's not going to happen. So you can do it cheap and good. You can do it cheap and fast, right, et cetera. And I think this is the thing I think we would say that as we see the challenge coming forward is that a lot of the places we're working with, this is a time of declining funding for a lot of state institutions we're working with, community colleges, private institutions. Resources are getting tight. And I would say at most places, this is the first thing. Right, that we work with, that expensive faculty development or staff development efforts are not part of the equation. There are limited resources, et cetera, and so we start from this premise at a lot of places we're working with, and so then we have to do this, right? Fast or good, fast or good. And in theory, you want to say, well, we're going to do it good, so it's not going to be fast. But in fact, I don't think that's what happens at a lot of places. It turns out, I think when we talk about why not learning improvement at some places and so on, I think a lot of places are going through cycles where they're reporting and getting things out so quickly they're not actually taking the time necessary to work through stuff, right? And it's not that they're trying to comply and move things along. And I'm not sure they get a sense of realistic time horizons from their leaders about this. And so we'll give an example. We've been working for the last 3 years on a scholarship of teaching and learning project, the CHIRP, Collaborative Humanities Redesign Project.
Yes.
Oh, good. Okay, it's a great project. So Dan Bernstein is leading this project with 4 institutions, and they've got about 25 humanities faculty who've decided to really engage in the process of scholarship of teaching and learning, do a baseline in their course, right? Really reflect on what's going well with the students, look at various papers. And the idea is to look carefully at student work to find out some area they want to work on. To actually then engage in some real thinking carefully about how to revise something, and then doing a serious measurement, although you wouldn't call it measurement in some cases, but a serious second review, do a change and do a serious review, and then create a teaching portfolio around that change, and it's really wonderful work. We've been looking at this stuff now. There's been great leaders, both on the campus level, and Dan's doing a wonderful job, and I think we would say it's an exemplary project. We just got done interviewing faculty about their work in the project, and people are excited, they've learned things. And in fact, what you start seeing is that, and this is what makes it hard for measuring learning improvement, the faculty are so excited, they actually don't want to wait to do the thing. They're starting to change things in other courses. It's actually really, really cool. But then we step back and think, this is 3 years to carefully revise one part of one course. It's excellent work. We haven't even talked about the level of the major department of curriculum yet, right? We haven't even started conversations about how some of these humanities courses might fit together in a department. That's going to be another 3 or 4 year conversation. And the places we've seen who've done good work, and they think they've really done sustained projects of 7, 8, 9 years where they're coming back to it. And I don't think a lot of people are framing it in that time frame. And so I think what our concern is as we go around the country and work with different schools is that we're seeing 2 trends, one of which we really like, but one of which we're really, in a way, afraid of, the consequences that are pinching together in some level. So what we do see across the country and some of these great national efforts and the value rubric and so on is that people are starting to really do work and assessment that requires more depth, more time, more care. The initial go-around of let's get a big test, give it to everybody. I mean, one of the reasons the Wabash study took off, I was told, from some provosts is that they thought this is assessment in a box. We can sign you up and just do this and we are done, no sweat, no muss, no bother. We're going to more stuff with rubrics, meeting papers, evaluating papers, and art, just work, so on. And it's good, but it's time intensive. And at the same time, there are fewer and fewer resources. There are more and more adjuncts that are working in places. There are cuts to teaching learning committees that we see. And so it feels like we're going down this funnel in a way that's not a really a helpful place, that we're adopting more intensive, more authentic, higher quality assessment efforts at a time when we're facing diminishing resources.
So, which leads to a challenge that we've been seeing, thinking about, and one that we hope we can all talk about and address over the course of this
Actually, we want you to answer it.
Well, yeah, exactly. Right now, you have 10 seconds after the question goes up. Now. So, the challenge. How can we do assessment that results in learning improvement in an inpatient environment with diminishing resources? Just a small question. But the ending point is, what has to change? Because clearly we think things do have to change.
And that's it. Leaving you on a high note, right? Oh.